US US health insurance system. How does the US health system work? Healthcare in the United States is organized in a complex bureaucracy, while in the rest of the world healthcare facilities are run mostly by governments or by private sector business. In the US, USA, large share of hospital and clinics are run by private non-profit organizations. Yet the United States is the country and has the higher highest healthcare expenditures in the world. While these expenditures are covered in a large share by public players as by federal institutions or state and local governments. They can also be covered by private insurance and individual payments. At the same time, unlike most dependable developed nations, the US health system does not provide health care to its entire population, as there is no single nationwide system of health insurance. The United States primarily relies on employers who evaluate voluntary provide health insurance covers to their employees and depends. In addition, the government has programs that tend to cover healthcare expense for the fragile parts of the society as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to getting health insurance in the US in not an easy thing. Someone may think that once you have many, everything is easily piercing. But in fact, things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance is the United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health insurance health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurance in the US: private and public. Most people use a combination of both. The US public health insurance are medical, Medicare, and Citizens Health Insurance Program. Medicare. Medicare is a national health insurance program that date back to 1966. It provides health insurance for US nationals nationals older than 65 years old, but also for younger people with end stage renal disease ALS and some other disabilities. Data shows that in 2080 Medicare provide almost 60 million provide individuals with health insurance in the US, over 51 millions of which are older than 65. The Medicare program in divided into four parts. Parts 1, which covers hospital skilled nursing and hospice service. Part B, cover outpatient service including some providers service while inpatients at a hospital. Outpatient hospital charge. Part C is an alternative called managed Medicare, which permits patients to select health plans with at latest the same service coverage as Part A and Part B. Obtain the benefits of Part D and as annual out-of-pocket spent limit which A and B log. To sign in this part on most thing in Part A and Part B. Part D covers mostly self-administered prescription drugs. Medicaid Medicaid is a federal and state program that helps people with limited income and resources to cover medical medical cost. While covering benefits normally outcovered by Medicare as nursing home care and personal care service. It is the largest source of funding for medical and health related service for people with low income in the United States. Data which that the US provide health insurance to 71 millions people with low income or disabilities, which is 23% of the total of the US population. Children's Health Program, Children's Health Insurance Program. Formerly known as the State Children's Health Insurance Program SCHIP. This is a program that covers with health insurance children of families with modest income that are not low youth to qualify for Medicaid. The Affordable Care Act Obama, Obamacare the Patient Protection and Affordable Care Act is a federal state signed into law by President Obama, which made it mandatory for every citizens to have health insurance for or be patient. Honestly, the act subsidies for low-income families by axing health care providers and high-income families, as it was designed to lower that care cost while providing better than health care for Americans. The Affordable Care Act allowed patients to add their children up to the age of 26 to their policies in a bid to have younger healthy people paying premiums. It also allowed poorer people to get treatment for chronic illness instead of using the emergency room. US provide health insurance. There are about a thousand provide health insurance provider in the US, with each of them offering different plans with different peaks, which largely depended on a person's medical history. However, while there are individual plans covering only one persons, there are also group plans targeting families in particular. Usually there are the types of health insurance in the United States. Traditional fee for service health insurance plans, which plans are usually the most expensive, that this with an income lower than the average income in the US have difficulties to purchase. However, these are the best plans as they offer you most flexibility. Health maintenance organizations HMOs, which offers a limited source of healthcare providers, yet it also offers lower co-payments and cover the cost of more preventive care. They are eventual and accorded to by the National Community for Quality Insurance Assurance. Private provider organizations PPOs, which just like homes offer lower payments, but they give you more flexibility when selecting a provider, as they give you a list of providers among which you can choose. How to choose a good US health insurance plan? When looking up for a good health insurance plan, make sure you ask questions like: does that plan get you with the right to go to any doctor's, hospitals, clinic or pharmacy you choose? Are specialists such as eye doctors and dentists covered? Does the plan cover special conditions or treatments such as pregnancy, psycho psychiatrics care and physical therapy? Does the plan cover home care or nursing home care and medicates as physician might prescribe? What are the de- deducts deductible? Are there any co-payments? What is the most you will have to pay out of May one pocket to cover expense? Make sure You also understand have a, how a dispute about a bill or service in handed by your provider as in some plans. You may be required to have a third party decide how to style the problem. We recommended to GeoBlue Explorer plan for foreigner to in the United States. Health insurance requirements for foreign visitors in the US. Through the United States, through authorities have not made health insurance mandatory for short-term travels to the country as B1, B2 visa holders. It is highly recommended for every traveler to get insurance before their trip to the country. The main resource any you should get insurance is that health insurance is the in the US extremely expensive, and when a checkup for a simple headache will cost by hundred of dollars, will a broken lamp limb will cost by thousands. Health insurance, health insights are never foreseen. Therefore, it is best to be prepared for it and get insurance. So, in case of need, you save yourself money. Yourself money. Health insurance options for legal immigrations. Immigrants immigrants that are lawfully present in the United States are eligible to get provide health insurance in the US. In addition, lawful immigrants may also eli- eligible for lower cost on monthly premiums and lower out of pocket cost based on your income as follows. Those with annual income 400% of the federal feder- federal provide low level or below may be eligible for premium tax credit and other saving on marketplace insurance, whereas those with annual household income in below 100% federal provide level that are not otherwise eligible for Medicaid or are eligible for premium tax credit and other saving on marketplace insurance. Given that many they meet all other eligibility requirements, most of the time qualified non-citizens are eligible for coverage through Medicare and Children's Health Insurance Program CHIP, given that they meet the income and residency rules of the state where they are based. Qualified or non-citizens are considered the following: lawful payments residents, asylees, refugees, veterate non-citizens, and sponsor city children or patients victim of trafficking and his or her spouse, child, sibling, or patient or individual with a pending application for a victim of trafficking trafficking visa. Cuban oblique heightened interest. This parallel into the US for at least 1 year. Conditions entered gradient before 1980. The gradient withholding of deportation and members of a federally recognized Indian Tribal of America Indians born in Canada. However, most of them will need to wait for 5 years in the US order to get Medicare and CHIP coverage in the US after they get qualified. Refugees and asylees are exempt from the waiting paid period. In addition, states have the option to mobilize the 5 years waiting period for children and pregnant women so they can be covered by Medicare and CHIP. You can get a free US health insurance quote here. While you are free to choose the plan that suit you best, we recommend the Geo Blue exploring health insurance options for illegal immigrants. Illegal immigrants in the US can get health coverage only from providers as the US government founded health insurance does not cover them. Community center can provide medical help to undocumented immigrants in the US, which is termed safety net provider. If the healthcare seeker can participate in free for service medical assistance.